Okay.
So go down to up here.
This one?
No, the other one. And click on the left one, the right one. Right image, click on it.
Okay. Perfect. Okay. Ah, this should be interesting today. So Fahima, interestingly enough, it's just you and me today. The other students.
Oh, okay.
Yeah, oh. So really, you can tell me how fast you want me to go or how slow you want me to go.
Okay.
I have the other students, because of the weather up here, it's very cold and we've had a lot of problems with roads and highways and so forth. So we just barely made it. So I have no classroom students as we right now, so I'm not sure if they're coming or not, but I'll just start the program. And then Alex, who is our other person who attends online, as far as I know, is not on yet. So there's just you and me. So, okay, we'll just get started. Okay. Going to do the digestive system today. I usually monitor how long it takes the students to write down the information. I just look at them and make sure that they've finished. But because I don't have anybody here today to look at and monitor how fast they're writing, I'll just kind of go through it with you, and you can say, if I'm going too fast or too slow.
Okay, so yeah, no problem.
Yeah, so it's just you're having an individual class today. Anyways, so we'll start off session. Yes, one-on-one. Okay. The gastrointestinal or the GI tract is oftentimes you'll hear people call it, and especially in the hospital or when you're working, they'll refer to it as the GI tract. Includes all of these areas: the mouth, the pharynx, which is the nasal-oral and laryngopharynx, and the esophagus. Those are all included, and there's some more in the next one. The cardiac sphincter is at the top of the stomach, and it helps hold the fluids in. So once you've eaten your meal and it goes down into the stomach, the cardiac sphincter closes and prevents it from coming back up the esophagus. The esophageal hiatus is meaning it's just going through the diaphragm. So that's where the esophagus goes, through the diaphragm. The stomach then, of course, is part of the GI tract. The pyloric sphincter, and like I say, I always highlight in red if it's something important that you need to know, is the other sphincter at the other end of the stomach, and it holds the fluid and all the chyme or the gastric contents in until it's time for it to be released into the small intestine. Now, the small intestine includes the duodenum, which is the first section, the jejunum, which is the second section, and the ileum, which is the third section. And we'll be talking about that later and giving you the dimensions and so forth. The ileocecal valve is the valve between the small intestine and the large intestine, and it's right close to the appendix in that area down there. The large intestine includes the cecum, which is the beginning of it, and where the appendix is. The ascending colon, which is easy to remember because ascending means going upwards. So the ascending colon, the transverse colon, and the descending colon. So those three are quite easy to remember. And then the sigmoid colon is going across, and it makes kind of a square shape. The rectal area is going downwards, and then the anus is just before the outlet of the intestine. So I have some photographs here, just kind of indicating to you where things are located. At the top here, we have, you can see the esophagus coming in, the cardiac sphincter that I was talking about that closes the stomach so that the fluids don't come back up your esophagus, the stomach itself. The pyloric sphincter is right in this area here, and then it turns into the duodenum. This picture is just more of a idea of where things are located. You've got the esophagus back here behind the liver. and coming into the stomach, and then your intestines. You can see how the large intestine just makes a square here. So you have the cecum, the appendix right here. You have the ascending colon, meaning going upwards, the transverse, meaning going across, and the descending colon going downwards, and then the sigmoid colon in here, the rectum and the anus there. Okay. That gives you an idea of where things are located. And okay, there we go. So the 6 steps of digestion, and this is something that you're going to see again, of course, is ingestion, taking food into the mouth, eating your meal. Mechanical processing, easy enough, chewing it up with your teeth and turning it with your tongue so that you mix the saliva. Digestion is an enzymatic breakdown, disassembling large molecules such as proteins, polysaccharides, and triglycerides into tiny little units so that it can be absorbed in the small intestine. So that's how they define digestion. Secretion is the release of water, acids, and enzymes. And I'll just let you read that for a sec. Absorption, of course, is the absorption of your food molecules, your nutrition. Excretion is elimination of waste products that can't be used by the body. And I was reading this morning that 1/3 of that waste product as stool or feces is actually bacteria that are naturally occurring in the intestine, which I was kind of surprised at. That's an awful large volume, 1/3 of the stool. The teeth, of course, the beginning. Mastication is just a word you're going to see again, and that means chewing. That's quite easy. And it works with the tongue as it moves the food around in your mouth. The enamel or crown is made up of calcium phosphate crystals, and I believe you've seen those in the bones before. We talked about calcium phosphate crystals. They're very strong. And below the enamel, being protected by the enamel, is the dentin, and that has a lot of your blood and nerve supply through the root canal, which is something we don't want to talk about because I've had root canals and they're very painful. Okay. So bacteria in the mouth produce an acidic plaque that destroys the enamel. That's why we're so concerned about brushing and flossing our teeth every day. And the calcified plaque is actually calcium deposit attaches to the plaque in your mouth and forms a tartar, which oftentimes if you go to the dentist, they actually have to scrape off. The tongue, the epithelium under the tongue is a thin vascular, and it allows absorption of lipid soluble medications, which is a nitroglycerin spray that you may have to use if someone's having chest pain and they have angina or they're having a heart attack. Lorazepam is another one that we use frequently for anxiety and to help people relax a little bit in bad situations. And it is an anti-anxiety medication, and it is absorbed very quickly. And it's placed sublingually just underneath the tongue. Simple sugars like glucogel, definitely used for diabetics who are having problems with low blood sugars. We can put that underneath their tongue, and it's absorbed very quickly. And it's a good alternative to using the glucagon injection. So you can use that if you're a lay person. You can use simple sugars like honey as well, works well for diabetic hypoglycemia. Responsible for the manipulation of food and secretion of mucins and lingual lipase. The lipases are digestive enzymes. Contain taste buds and sensory neurons. So that's for all your taste and different areas of the tongue, and I believe we talked about that earlier in the earlier chapters, where the taste buds were located for salt and sweet and sour. The wall of the digestive tract, there's 4 layers. From the outside, inwards, I put it that way. So the serosa is on the outside, and I have a picture here. I'll try to show you. It's one of the handouts that I've got here. And so I believe you will have something similar in your textbook. So you can see the outer first layer is the serosa. That's this one up in here. Not working well, is it? Okay, the serosa, I've got my finger on it up here. So it's the first layer of this circle. The muscularis is the inner circle. You can see that. The submucosal is getting closer to the center. And the mucosal is the last layer. That's the inside of the lumen, the inside of the tube. So the digestive tract there is some variance in the lining. The lining from the esophagus, from the mouth down to the stomach, is very hard and can withstand rough treatment, like, toast or anything like that. It has hard particles. But the lining on the after the stomach is much more fragile, and it also is much smoother. So it allows absorption on the other side of the stomach. So there's a little bit of variance, but they are still the same layers. So, like I said, their serosa is the outermost layer, and it covers the muscular part. And it helps anchor the digestive tract to the abdominal cavity. Peek over here to see if Alex can join us. No, he didn't. Okay. The muscularis externa, which would be, externa always means outside, right? The circular layer, muscles are circumferal, meaning circular, round. And you can see that in the picture that I have here. Try to show it to you. Right there. Okay. This is a challenge. This is one of my fun challenges here. Is this layer that's right in here, this reddish layer here, is the muscularis. And its circumference, it goes all the way around. Now, it assists with peristalsis, but it works with the longitudinal layer that runs, well, longitudinally would be all the way along. Both of these these muscular layers work for peristalsis. Now, peristalsis is the movement of the food bolus through the intestine. And I've got a picture of that too. So as the circular layer contracts, the longitudinal layer pushes it along. So they work together. And let's see if I can get this up here. So you can see right here, picture the peristalsis. The boluses of food, the green parts, are moving along the digestive tract. There's peristalsis coming down from your mouth to the stomach, and also peristalsis beyond the stomach itself. Okie dokie. The submucosa and the connective tissue that secures the mucosa to the muscularis externa. It contains large vessels and nerves and your exocrine glands, just to remember that. And it's innervated by your ANS, autonomic nervous system. And it also has sympathetic fibers and parasympathetic fibers, and that makes perfect sense when you think, when you get upset about something, sometimes your stomach gets upset, so it is sympathizing with your situation. So it works with both the sympathetic and parasympathetic. Mucosal epithelium participates in digestion and absorption and production of this digestive enzyme. So filtration and absorption through the microvilli into the bloodstream. And I think it shows up better on this one here. I'm just going to try to find you a decent picture of it. No, not here. Ah, that's a good one. So right here you can see, move it wrong way. There we go. The challenge. So right in this area, right here. Hi. Oh, you made it. Hi, Brenda. Good. Brenda's just here. Talking to the students online. No problem.
Hello.
So this is, Fahima says hello. So as you can see right here, this is the microvilli. This area, these little kind of little protrusions, I guess you could call them, little lumps that stick out of the intestine. Then the good part about the microvilli is they actually increase the surface area. So the more of these little microvilli you have, the larger the surface area. That just makes it easier for it to absorb nutrients. I can give you the rest of the information later, it's okay. I was just saying how hard it is to teach a class without a student sitting there writing, because I always monitor your writing, like, oh, yeah. So I'll give you these, okay, later, so you won't miss out. There's handouts right there too if you want to grab those. So we're just working on the lining of the intestines in the GI tract right now. So yeah, those three there, and then we'll do the kidneys later on. Yeah. I know. I was telling Fahima how cold it is up here, and that's why some of the students haven't come today. Really cold. They actually, I was talking to the security guard, and he said that they closed early because students just aren't coming because it's, you know, the snow and everything on the roads is keeping people away. So yeah. So the acidic digestive fluid, it protects the surrounding tissues from the acid digestive fluid and mechanical abrasion, right? Mucus makes it nice and slippery and stops. Anything like you're eating that's got seeds or anything like that would be mechanical abrasion. Protects it from with macrophages and other immune cells. Provides a non-specific defense, right? And we've talked about non-specific defenses when we did the immune system. They're just a kind of a non-specific is just random. Like anything that comes in, the body will protect from it if it's foreign. Now this is just a picture of the microscopic picture of the villi. I lost my pointer pen. Oh, there it is. So you can see here the villi, these little protrusions here. And it gives you a good idea what they have as well. I mean, you can see the mucosal glands. You can see, what else? The picture here itself is the whole thing we're talking about. We're going to be reviewing this as we go along as well, the mucosa epithelium and the lamina propria. Okay, the mucosa itself is the innermost layer of the digestive tract. And that's, again, we just talked about the plica and the villi and the microvilli. Pardon me? It's kind of a review. It is, yeah. Because we've talked earlier about villi and so forth. So the lamina propria is a layer of connective tissue. And like I say, whenever you see something that's a little bit different color, you got to pay attention to that. The mucosa itself has the mucous goblet cells, which are the mucus cells. And the mucosal ducts extending up from the submucosal glands. So that's the innermost lining. That's the one that's touching the food as it goes by. Good. The lamina itself is a connective layer, and it contains all of your supplies, vessels, right? Your blood vessels and nerves and lymphatics. The smooth muscle, it always has a tone. Like muscle never is just completely flaccid unless you are having problems or, you're very, very ill. It always maintains a tone, and it can be increased or decreased with the ANS stimulation. And that's your para and sympathetic stimulation. Has mucus cells as well. Peristalsis, we kind of discussed a little bit earlier. I showed some pictures of that, moving the bolus along. And I'm just going to show these to Brenda. So Brenda, right at the bottom, you'll see those little lumpy things. I'm losing my cord here. Right here, you can see as it propels. This is food bolus, and as it contracts, it moves it along. So it kind of, neat. That's called peristalsis, right? Yeah. So you have all sorts of different diseases later on in your other classes that you're going to learn about. If you don't have the peristaltic action, it can create a lot of different diseases. And so peristalsis, like I said, moves the bolus along. Bolus is a word you're going to be seeing again. So the circular and longitudinal and peristalsis are words that you're going to be seeing again. The peritoneal cavity itself, also called the abdominal pelvic cavity, is just the whole cavity, starting from under the diaphragm and going all the way down to where in women with the uterus and all of the pelvic organs are located. So this is just a picture here of the peritoneal cavity. Like I say, it includes all of the organs. Whoa, go down there. Okay. Yeah, that's no, it wouldn't be. Hopefully nobody's hungover. So it's lined with a layer of peritoneum, which covers most of the abdominal organs, intra-abdominal organs. Can you see around that? Yeah. Okay. Oh, okay. Okay. Yeah, you could come up here and sit here. Or take Danielle's place. She's got a good place. Good. Okay. So the peritoneum itself is a sheet. I don't know if you can see that at home. Sheet of serous membrane that lines the abdominal cavity and covers the organs. It produces serous fluid that helps the intestine move, right? Because your intestine, you can feel it moving sometimes if you had a lot of food or whatever, you were maybe a bit gassy or something, you can feel the intestines moving, and it moves much easier because of the serous fluid that helps There's a very small amount. It's only about 60 cc's. It's not a lot, but it's just there to help movement. The peritoneum also serves as a conduit for blood vessels and lymph vessels and nerves. It secures organs in place by extensions called mesenteries. And then off all the legs. Hi. Mesenteries, yeah, right here. There's gonna be more information about them on the next slide. The peritoneal membrane is similar to the pericardial and the pleural membrane. Remember we talked about that, the pleural membrane that surrounds the lungs, the pericardial membrane that surrounds the heart. The outer layer is parietal and it's attached to the abdominal wall. The inner layer is called visceral, which makes sense because it's closer to the organs. It's wrapped around the organs. Whenever you see the word visceral, you know that an organ's involved. And the space between these two layers is called the peritoneal cavity. And this is important later on when we talk about doing peritoneal dialysis for people who have kidney failure. Then we'll talk about that later too. The mesentery itself, it anchors to the abdominal wall in the back by the spine. And it also provides a nice protective path right in here for vessels and nerves. It prevents twisting of the bowel. And this is important because sometimes kids will get twisted bowels. So in this picture, it's in the next slide too. You can see where the mesentery is holding on to the intestine. And it is like an apron. The mesentery and the omentum, they are extensions of the peritoneal membrane that are doubled up around the incoming and outgoing vessels. So meaning that they come down and around like that, meaning doubled up. And again, they're for support of the vessels and to provide nutrition. Oops, sorry, are you okay? This is just a cross-section view. Do you want me to go back, Brenda? Do you want me to go back? No, are you good? Okay. This is just a cross-section view looking down the spinal column where you can see where the stomach is located and the kidneys. I think that was in your book. Segmentation. Random muscular contractions that do not propel the food forward. Segmentation happens in the stomach when it's churning all your food around after you've eaten. And the end result of mixing everything together, the enzymes and all the gastric acids and secretions, is called chyme. Yep, and that's the word you should know. So this segmentation also happens when it's moving along the bolus we had earlier. I showed you. Okay, because in each one of these little segments, there's churning going on in the intestine. So segmentation happens in the intestine as well as the stomach. And down here, there's just a comment. It's the circular muscles that are responsible for doing that. Digestive control. Digestion is regulated by the nervous, endocrine, and just local mechanisms. Neural mechanisms, sensory receptors in the digestive tract. They sense the bolus of food coming down. My pen again. It's getting lost. So then the stimulus is received by the stretch. As the food goes down, it stretches. It stretches the esophagus, but also stretches the intestine and the stomach. So the whole area is stretched. And muscular contractions and secretory glands are controlled by motor neurons. And I put this in because we'd already studied the motor neurons, right? Oops-a-daisy. It's gone too far again. I know, it's just, well, yeah, if I press it just a little too hard, it just jumps. Okay. So, yeah, it's kind of tiny. Hormonal mechanism. The major hormones that control the digestive functions are produced and released by cells in the mucosa of the stomach and small intestine. So that's where those hormones are coming from. They're released into the blood of the digestive tract, and they can trigger other organs. And this is important because the other organs that are accessory organs to the GI tract are the liver and pancreas, and they also produce enzymes to help with digestion. So appetite control, which is something we all want. It's like, oh, I need that. Hormones that manage appetite. Now these ones you're not responsible for knowing, but this is more of an interest thing than it is for something that you have to memorize. So these two, like I say, they are controlling your appetite. One stimulates it, and the other leptin inhibits the appetite. So you're okay with that. You don't have to write that all down. The local mechanisms, though, the chemoreceptors in the GI tract, respond to changes in the acidity as well as other chemical physical stimuli. So they release acid or alkaline buffers. That's what their responsibility is. You have prostaglandins and histamine and other chemicals are also released by tissue cells that affect how you digest. And histamines are released, we learned, with allergies, right? You get histamines released. So if you're allergic to peanuts or something like that, you may not get a respiratory reaction to it, but you might get a GI reaction to it, and you would have probably diarrhea because the body is trying to get rid of whatever is causing that allergy. Saliva glands and saliva. This is an awful lot, 1.5 liters of saliva produced a day. And I'm thinking, you know, when they tell you you're supposed to drink lots of water, I think I don't even drink that much water. I can't produce saliva. But like this is something, this is interest, right? You don't really have to memorize that. Okay.
But I probably will because it's like, wow,
That's a lot, I know. But your saliva in your mouth as you roll your food around with your tongue is released by your salivary glands. And a couple here, you can see the sublingual here, submandibular, and the parotid is the biggest one. Now the parotid gland is keratitis caused, and that's mumps, right? So that's the welling of the parotid gland if you get mumps. My aunt's, I shouldn't say my stepmother's cat is named Mumps. Yeah. Well, he's got this round face with this big kind of cheeks, like really big cheeks. So she got him from the SPCA. He was a rescue cat, but his name was Mumps. It's cute. It's really cute. Tom? Tom cat. That's,
He looks like a midget cat. He doesn't seem to be growing.
oh yeah?
And it's funny that she calls him Tom because he's nowhere near Tom cat.
Midget cat. That's cute. Okay, dokie. Okay, so it lubricates and starts to break down salivary amylase. Amylase, we're going to see later these different enzymes that help digestion, and they're particular for certain things. There's one for carbohydrates, which says his amylase is for carbohydrates. There's one for fats, and there's one for proteins. It just gives you the how much water that saliva contains. Please don't get panicked about that either. And they're antibodies. Remember our antibodies, the IgE? I had a picture there that had a list of, I don't know, 8 or 10 of them.
Yeah.
But this one, they do contain antibodies. So that's kind of one of your first lines of defense if you eat, right? It's the first thing it's coming in contact with.
I was watching
Yeah?
I was watching animal shows, like animal documentaries where they're
Yes.
showing all this kind of stuff out there.
Yeah. And it kind of goes together. We already talked about where they were located, the saliva glands. Had a picture of that. So we're just going to talk about the upper digestive tract and the pharynx, which is there, the common passageway here. Go this side, this looks better. So you see the pharynx up here, which is the common passageway down to the lungs and also down the esophagus. So it's shared passageway. Again, the pharyngeal muscles move the food down, and that's a similar peristaltic type action. You can see the narrowing here as it pushes the bolus down and through the cardiac sphincter. There's the diaphragm right there. Innervated by the ANS, your autonomic nervous system. Because you don't have to think about doing this. It should just happen normally. Think about swallow. Mind you, sometimes I have to think about swallowing. I don't know why. And then you can't swallow. Oh, if you're at the dentist, right? Yeah, and then you're trying to swallow, but you can't. Yeah.
You don't want to swallow, so you're pushing
Yeah.
everything out.
Exactly. And then you can't remember how to swallow. It's like, what?
Yeah.
Okay. So the esophageal sphincters, there's two. And we looked at the esophagus, and there's one at the top, a very small one, not as important as the cardiac sphincter. Just stepped on my, hopefully that's still working. Stepped on the mic. There. Okay. So the esophagus sits behind the trachea. So the trachea is right in the center here, and the esophagus sits right behind that. And it passes through the diaphragm, the esophageal hiatus, then empties into the stomach. So it's just a photograph of just how it works, how the tongue pushes the food back after it's mixed it around, back from the hard palate, which is in the front, into the soft palate, and the throat muscles as they squeeze the food down.
You don't even
You don't even think about, yeah, that's right. So just down here, they've got a little arrow, meaning this area here is where the epiglottis is. We talked about the epiglottis because the epiglottis folds over top of the vocal cords and prevents any food from going down into your lungs. So the stomach's major functions are storage. It can hold 1 to 1.5 liters. And like you say, all of these numbers that you'll see are numbers just for your interest. And it's for the mechanical breakdown of food when it churns it around and mixes the food with the gastric juices. When the stomach's empty, it just sits like a deflated balloon. It doesn't stay rounded. It's only rounded when you have food in it. And there are folds called rugae. And when the stomach fills out, they just open up like a balloon, and it just makes it a round, hollow organ. The stomach produces gastric juice itself to help with digestion. And that's your hydrochloric acid is one of them. They also produce factors that will help digest and for the absorption of vitamin B12. Erythropoiesis. That word? Do you remember that word? That word. What does that mean? Do you know? When you see a urethra, what? Red. What else? Oh, that's okay. That's okay. So production, help assists with production of those. Produces chyme, which is the food bolus that has been mixed up, and it's a very liquid bolus and kind of like thick soup. Yeah, it's okay. Whenever you see urethral, though, when you see that part, it's always to do with the blood, right? Yes. Blood should pop into your head. Okay. So we've kind of chatted about that already. It mixes things up and it churns things around. Just to mix all the food with the enzymes and digestives. So we've learned about when we did the neurological system, it's coordinated by sensory neurons, interneurons, and motor neurons in the autonomic nervous system. You probably don't have to write this down because you've got it in your notes somewhere else. The gastric juice, and we talked about the lamina propria before. That's a lot of, it's making me think I should be drinking a lot more water. Because I'm thinking, oh, I don't drink that much. I'm sure I don't drink that much a day. Mm. I don't get thirsty. That's my problem. If I get thirsty, then I'm really dehydrated. but I just don't normally get thirsty. Anyway, sorry. Gastric fluid, hydrochloric acid. I think everybody knows that. And intrinsic factor. That's what it has in it. So the gastric juice continues. It has a protein complex to help digest proteins, and that's all that really means. Has pepsin, the enzyme that required for digestion of protein. So that, remember I said there's certain enzymes for certain different, like fats and carbohydrates. So this is for protein. Breaks down plant material excluding cellulose. Now cellulose is the outer husks of brown rice and that type of thing, any kind of roughage. And that's where you will have a lot of people who should have more fiber in their diet so that they can have a normal GI system function. So this is easy. Pepsin digests the proteins. Gastric lipase digests the fat. And whenever you see like Li at the front, right, you know that it's for lipids. It's digesting lipids. So that will help you remember that. And renin is only produced in infants, and it's to digest milk protein. So that's where we come back to, should adults be drinking milk? we talked about that before. Some people can't digest milk, and I'm one of them. And I think that's why I probably don't have any renin in my body anymore. The pyloric sphincter, I think you missed this one when you came in. The pyloric sphincter we talked about, it's at the end of the stomach, right here, and it stops the chyme, the digestive stuff, from going into the duodenum. So it closes it off while the stomach churns, so it doesn't just drain in there. This pyloric sphincter sometimes causes problems in babies. They get pyloric stenosis. And this is so tight that they actually regurgitate all their food and projectile vomiting with babies. And that's what the problem is that pyloric sphincter is just too tight. Sometimes they'll just leave it and the baby will just kind of outgrow it, or they have to go in and do surgical procedure to open it up a little bit. The pyloric sphincter too just releases small amounts of chyme out of the stomach. It doesn't release everything out of the stomach all at once. It just releases tiny amounts so that the intestine can start the digestive process. The small intestine, that's where 99% of the nutrients are absorbed. So it's so important. The small intestine is healthy and functioning well, so you can have good nutrition and good health. So it's the curved part that's closest to the stomach. It's the first section of there. I don't have a picture. I have pictures of everything else. I must have pictures of that. There we are. I got a picture. Okay. Not a very good picture. Anyways, this just shows the stomach. Here. Okay, stop moving. And over here is the duodenum, the first section of the small intestine coming out of the stomach. So because it's so close to the stomach, sometimes if the gastric juices can cause ulcerations, you get duodenal ulcers. The jejunum, which is the next section, is just below. And it's the bulk of digestion and absorption occurs. So that's why the jejunum is so important. Feeding tubes, you may have a patient that has a jejunosotomy, which meaning when they give you the sections here, if it's a jejunosomy, you know it's in the jejunum. If it's an ileostomy, then it's in the ileum. So it tells you whereabouts these tubes can be located. Because the fluid in these is so liquidy, sometimes people have jejunostomies where the food is coming out, you know. And the problem is then you lose a lot of your nutrition. So these people can get very dehydrated and have a lot of nutritional problems. So the ileum, again, is the most distal part, the longest section of the small intestine. And an ileostomy is an external opening to drain waste after nutrients have been absorbed. And this, like I said, is where you get into problems, because if this food is you haven't absorbed all the nutrients out of it, then oftentimes these people are kind of weak and very ill because they are having problems absorbing nutrients. Colostomies are much better because by that time you've absorbed all your nutrients and all really you're doing is getting rid of the waste products. Structures of the small intestine contain the permanent folds that are not smoothed out when the intestine fills. It increases the surface area. We talked about that earlier. Increases the amount absorbed on that surface area. There's the villi, and we looked at a picture of that earlier. Those are the little finger-like projections, and they are located on the columnar epithelium. And again, because they increase the surface area, they increase the amount that is absorbed. So you have also, on top of the villi, you have microvilli as well, which even increases the surface area more. They're kind of piled on top of each other. The total surface area available for absorption is 2,200 square feet, which is a huge, huge amount. But like I say, these numbers are just for your information. That is huge. That's a big area. A large intestine. It begins at the ileocecal valve, where the ileum attaches to the large intestine. The ileocecal valve controls how much of the digestive material is coming into the large intestine, so it's an important valve as well. The cecum is the lower part of the large intestine. The colon itself is, as we talked earlier, is ascending, transverse, and descending. Brenda, you weren't here when we talked about that, I don't think. Oh, okay. But it's just a square. The colon itself, I'll just get a picture here. And if I can hold it up for you. So you have the ileocecal valve is right here. Can you see from there? Okay, coming up. Okay. Yeah. The online students saw it already, I think. So the ileocecal valve is right here. The appendix is here. And then ascending is going up. Yep. Transverse is going across. Descending is going down. And then the sigmoid here, and then the rectum is here. Oh, cool. So it's easier to remember because ascending is up, transverse is across. And it makes it better for studying. It's a square. Yeah, just over down. Okay. So the colon, I talked about, okay, rectal area is where the large intestine exits the body, and it's where a lot of stool is kind of stored. And if you have elderly people and they're constipated, the rectal area gets very stretched, and it doesn't function well after it's been stretched from constipation. So that's when you start doing the enemas and doing all these other things to try to get them to have a bowel movement. The anus is just the exit and has a sphincter around the exit, of course, to keep the stool in. Oh, we have a picture, yay. Okay, kind of went through that already, so I'll just kind of skip over that. I'll go back and just say something about this. These flexures, where it turns, they're called colon flexures. This one's not so bad. But these two up here, they sometimes cause people pain because all the gas in the food kind of collects here. And if they're constipated, they'll end up having abdominal pain, but it'll be right up quite high, just under the rib cage. So if you have a patient that's complaining about pain up under the rib cage, check and see when they last had a bowel movement, because it could be that's what it is. It's just that all the food is backed up. And it sits in these curves because they're corners, and causes pain in those corners. So if you were to do a light palpation on their tummy, they probably would tell you it's hurting over here on the right and then hurting over here on the left side. The pancreas, oh, my favorite organ that doesn't work. Okay, it connects to the duodenum just below the pylorus. Right? So the pyloric valve you have, and then just, I'm making bunny. No, sorry, the pyloric valve that you have. And then just below that, the pancreas has a nice tube that comes out of the pancreas that drains out the digestive enzymes and the buffers. So it is an exocrine gland. And remember on your midterm exam, I do believe, what one organ that has exocrine and endocrine, right? It's the pancreas. But that's the only one really that has that. Because as soon as you have ducts, then you have an exocrine, and as soon as you have substances that are released into the circulation, into the bloodstream, then you have an endocrine. And I made sure that I put glucagon in there too, because that was another problem on the exam. People read it too quickly, and they thought that glucagon was glucose, and then they gave me a wrong answer. So, don't do it again. Okay. So it connects to the common bile duct that extends from the liver and the gallbladder. So if you have a picture close by, I can show you that as well. Yeah, there we go. So in this picture, I'll bring it back to you, Brenda, in a minute. To get it up here. And get really close. Too close. Why is it always tipped? Aha, okay, that's better. Now I'm looking here, and you can see the common bile duct that comes down here. The common bile duct joins together with the gallbladder and the bile ducts from the liver, and that's called the common bile duct. So it comes down here and it connects up with the pancreas down here. So they both drain in together, and then they all drain into the duodenum. Yeah. That part there. Okay. Pictures are way better than reading it. Really to read it, and it's hard. If I take a picture, that means something.
Yeah, that's you.
So it excretes alkaline and pancreatic juice, digestive enzymes, and ions. It assists in digestion, and it alkalizes the acid in the chyme. So it neutralizes, right? It neutralizes the acid coming out of the stomach. Good. Stimulation of the pancreas. Yeah, what have they got? Oh, they do. Okay. So duodenal hormones trigger the pancreas to secrete pancreatic juice. And again, 1,000 mLs a day. I really got to drink more fluids. It's still a lot. It's like we're all fluid, right? Yeah. Well, we are. We're what, 70% or something? Yeah. So chyme. Sorry, go ahead. Yeah, you would, because we've got to do all this, right? So chyme initiates the release of the secretin. Secretin initiates the release of pancreatic juice. So it goes in that stages. The hormonal stimulation, which causes the release of pancreatic enzyme and triggers the release of insulin, right? I can't remember which was the question on the midterm about insulin. I haven't got them all memorized. But insulin is super important in your nursing. You're going to meet a lot of diabetics. because there's a lot of us out there. There's no rush, Brenda. It's okay. I can't believe how fast time goes. Look, it's already 20. Either that clock's wrong or... Nope, it's not. Very fast. Good, thank you. The liver, yay, great big liver. Yeah, classified as the largest exocrine gland in the body. It's got a huge blood supply as well. It has arterial blood from the hepatic artery. It actually has its own artery coming in. A venous blood from the hepatic portal vein returns blood from the capillaries in the esophagus and stomach and small intestine. So it's extremely well serviced by the cardiac system. The nice part about a liver, you can actually live with just 1/4 of it. You don't need to have all of your liver. It can, and actually regenerates. I think it's one of the few organs in your body that also regenerates. We can do liver transplants with a portion of the liver because the liver actually you don't need to have all of it, right? Portion, yeah. Yeah, it will regenerate itself actually after they've removed it, or parts of it. It takes a long time, but it has the capacity to regenerate, which is, you don't get that with any of your other organs, right? You can't regenerate a kidney or a heart or anything like that. So it's one of the few organs that will regenerate. Yeah, it is good. So this is just a diagram, and it's indicating how much of the circulatory system is involved in feeding or taking care of the liver. So there's a huge portion of our system that takes care of the liver. This diagram here just gives you a list of what the liver functions are, but we're going to get into that anyways. We just talk about the blood flow first of all. So all the blood leaving the digestive tract gets filtered through the liver by the portal veins. And then the liver is responsible for extracting nutrients and toxins. And this is when toxins become a big problem for the liver, because people who will overdose on things like even acetaminophen can cause liver damage if you take huge doses of it. Whenever you have someone who's overdosed on any medication, we do liver enzymes and we do liver tests to see if it's damaged the liver at all, because it's the major one that's responsible for that. So that's why you'll see when you have elderly people, their liver functions change as they age. So maybe giving them medications at the same amount that you would give a normal healthy adult will cause them to have problems because they can't detoxify it as well, because their liver isn't functioning as well as it used to. So you'll find when you do your dosages in pharmacology that you're giving your elderly people much less of a dose, like Gravol, for example. You might give a normal healthy adult 100 milligrams of Gravol, where you give your elder person only 25 milligrams. And because their liver isn't functioning as well as it used to. So the liver also is responsible for storing glucose and glycogen and lipids as well. So it's used for detoxifying and storage. The main functions of the liver: carbohydrate, lipids, and amino acid metabolism. waste product removal, and vitamin storage, and mineral storage, and drug metabolism, which we just talked about. So it's an extremely important part of your body. You couldn't function without it. That's why you'll see people who have had, let's say, hepatitis, and there's been some damage from having hepatitis, that they may end up having vitamin problems, that they can't have, they can't deal with vitamins, they can't store them. And we talked about acetaminophen is the one thing you get overdosed fairly often, actually. But it's usually not because people are trying to overdose to hurt themselves. They're taking it for arthritis, or they're taking it for some illness that they're trying to control the pain, and they've just taken too much over a long period of time. That's another thing. It's the time factor. You can take quite a bit of acetaminophen for a couple of days. Like with kids with earaches, oftentimes you can give them a higher dose because they're in pain, but it won't really affect their liver because it's over a short period of time. So the liver also has phagocytes. Yay. Oh, and Danielle's not here for her phagocytes. Okay. Oh. So it takes down, phagocytes, of course, would reduce or get rid of any old cells that are no longer functioning and bits and pieces of debris and toxins. So it presents antigens to the immune cells to stimulate them to produce antibodies. So it synthesizes plasma proteins, and it's very important for clotting proteins. Good? Okay. Removes circulating hormones like your epinephrine, norepinephrine, insulin. So it cleans those out of your system as well. And definitely important if you've had an exciting event, so you're very nervous and you have a lot of epinephrine floating around. It helps to remove that. When we were doing the skeletal system, talked about the conversion of vitamin D, calcitrol and calcitonin and all those wonderful words that you will see again. Removal of antibodies by breaking them into amino acids so that they can be recycled. And storage of toxins and fat deposits, which are really dangerous. And LSD was a big thing when I was in nursing school. A lot of people we'd have coming into the emergency department on high on LSD and on kind of trips. Trips. It was stored in the fat, actually, and they're finding that some people, as they lost weight later on in life, they would have another LSD trip unexpectedly because it had been stored in the fat. Yeah. Once the fat was broken down, it would release it. No. Hopefully it would have happened probably quickly. Well, the other thing is estrogens. Estrogens are stored in your fat as well. So people who are very thin sometimes have a little bit more problems with menopause because they don't have any backup storage. Are you good? Okay, great. So removal of some of the toxins can be excreted in the bile, and obviously that's great. So the bile, we just had a picture of that we looked at. It moves down into the duodenum and it alkalizes the chyme, gets rid of that hydrochloric acid so it doesn't burn your intestines. Now the bilirubin pigment, when we talked about the Rh negative babies, remember Rh negative moms, Rh positive babies, and that's what happens when the red blood cells are broken down. They have a bilirubin pigment that goes to their skin. It also, the bilirubin also dyes the stool. It makes it a brown color. If there is any problem in the release of the bile into the duodenum, if it's blocked by stones or inflammation, the stools oftentimes will turn white. So if you have a patient with white stools, think maybe they have a problem up here in the liver with those bile ducts. It might be causing them issues. Oh, we got a picture. Okay. Well, actually I like my other picture better. It just shows the gallbladder and where it enters into the common bile duct and then into the duodenum. The gallbladder stores bile, which is responsible for emulsifying fat, breaks down fat. Usually when you've had a patient who's had a cholecystectomy, which is removal of the gallbladder, they have to be on a low-fat diet because there's not that storage of bile that is pushed into the food bolus to break down the fats anymore. So they have problems digesting fat. So this just explains the CCK, which is another enzyme, which is a trigger. So it just allows the common bile duct to open and allows the bile to go into the duodenum. So it just says when the CCK is not present, it's just a storage. Then the bile is stored. When you have a meal that's got a lot of fat in it, like your fish and chips, which I totally love, it increases the production and releases a lot more bile to digest fat. Chicken burger. That would be good. Yeah, I'm getting hungry. Okay. So the large intestine itself absorbs less than 10% of the nutrients. It's more to get rid of water and make a compact kind of a waste product. But it does absorb some vitamins because there are bacteria in the colon. Actually, I should have put colon there, large intestine and colon, because you won't really hear doctors and nurses talk about large intestine. You'll hear them talk about the colon, or they have colitis, they have colon problems. Next time I redo these again, I'll put colon there. So the important vitamins are cofactors or coenzymes required for metabolic function. The normal flora within the intestine produces 3 vitamins that supplement our dietary intake. And I'll just flip to those. Are you good? Okay, because those ones are just. So vitamin K is produced and that's for clotting. We talked about how vitamin K works with the fibrinogen and fibrin. And it's in things like rhubarb. That's a rhubarb. Eat lots of rhubarb. Botan helps with glucose metabolism, and pantholytic acid, or vitamin B5, is used for steroid hormones and neurotransmitters. So those are the three that the bacteria in the colon help to produce. So we kind of need those bacteria whether we like them or not. Okay. And they don't really cause a problem. Bacteria only cause a problem when they get into, say, like the bladder, and they crawl up into the bladder and then create bladder infections and things like that. But usually the bacteria don't cause a problem in the bowel. So the feces themselves, what's left over after digestion, is 75% water and 5% bacteria. And the rest of it's just indigestible things that your body expels because they don't really have a use for it anymore. Mm-hmm. There goes more water. Yeah, that's right. Yeah, I gotta drink more water. I don't know. It was one of the comedians. It was really fun. George Carlin, actually. I think it was the older comedian. He said, "It's just so depressing to think that a good half of your body turns to poo every day." He's hilarious. So the medical disorders, and we'll go through these, I think, and then we'll have our break, okay? And then we're finished this section. So gastritis is whenever you see the itis, right? It's an inflammation. That's easy to remember. Gastra is your stomach and so forth. Can be caused by anything. It can be caused by bacteria, viruses. It can be caused by food that you're allergic to or food that you just don't agree with. It can cause an inflammation of the gastric mucosa. So it can lead to an erosion of the gastric mucosa, which would be maybe pathogens, and it's called H. pylori, right? I'm sure you probably have heard of that. It used to be years ago that they thought that gastritis and ulceration of the stomach or of the duodenum was caused from the acid. But as it turned out, it was actually one of the big causes is this bacteria. And the treatment now for that is 2 different types of antibiotics and then antacids as well. This is just a picture of a gastrostomy tube, which is for enteral feeding. And that's just like a feeding tube. And you can see here where it's put into the stomach. Got a little bulb on the end. This is deflated when they put it in, and it's surgically put in surgery, and then they put it in and inflate that little ball so it keeps it from sliding out, and that's where your tube feeding is going into through the. And unfortunately, there was more pictures of tube feeds there, but they didn't show up. You can just see here where it's placed on this person's stomach right there. So the only problems you have with these are watching for infection around the insertion site, making sure that that's kept really clean. Talks about gastrointestinal ulcers, and I've already talked to you about the H. pylori, and that is a bacteria. Cholecystitis is inflammation of the gallbladder. There's lots of people out here who've had problems with their gallbladder, either gallstones or just inflammation. Gallstones can be very, very painful, especially if they start to move and they start to go down that common bile duct. Oftentimes, like I said, if they block off, then you don't have any of the bile coming through, and you will have changes in the color of the stool. They'll go white. They'll block it off. Very, very painful. People will definitely come into the hospital in a lot of pain if they're passing a gallstone or if they have cholecystitis. And if you have cholecystitis, if this is inflammation, every time you eat a fatty meal, it stimulates the gallbladder to contract and, of course, stimulates the pain. So having fatty meals when you have gallstones or you have cholecystitis can be very painful. Also, I have a friend who had cholecystitis, but it was oranges. Every time she ate oranges, she'd have huge pain. So it depends on the person as well, what they'll react to. They can do for the stones, they can do a cholecystectomy, which would remove the whole gallbladder. That's the word right there. Or they can do a lithotripsy, which is sound waves that break down the stones into smaller pieces, and then they just are passed. And usually during the time they're passing, they give you lots of pain control so you can pass them without suffering too much. Post-lithotripsy. It's so much easier now than they used to take out, have to do surgery to take out the stones, but now they can just do it all with fiber optics and use the optic stuff, and it's so simple now. Well, some of them, people who have them removed, or it's a daycare surgery, it's not even a very long surgery. Pancreatitis, now this one can be really, really bad. It can be very painful. The pancreas itself, caused from a blocked duct, it can be drug reaction or pathogens, or ischemia, meaning it's not getting enough blood supply. Alcohol or drug consumption as well. So the problem is it results in what they call autolysis, which is the breakdown of its own tissue. Because the pancreas is full of enzymes and full of digestive materials, it starts to break down its own self, and it can be extremely painful. And then if there's enough damage, of course, it damages the beta cells that produce insulin. So you may end up being diabetic as well. So hopefully nobody gets pancreatitis. Peritonitis. So that is the peritoneal membrane, that little apron that's holding all of your intestines up and supporting them. So it also can be inflamed and cause quite a bit of pain. Peritoneal dialysis, when we're putting in the fluid into the peritoneum to take out all of the toxins when the kidneys are no longer working, can cause it. Any type of infection from surgeries, injuries, that type of thing, injury to the stomach, or any leaking. If you had an appendix, so it's here, appendix that is ruptured, all of the material, like the feces, comes out of that area and gets into the peritoneum. It causes inflammation, of course, and it's very, very serious. And in the past, years and years ago, when they didn't do the appendectomies right away, sometimes they ruptured. People would actually die from peritonitis. So it was very serious. And apparently my appendix was just about to rupture, so it was good they took it out. But I was just little then. Ascites. This is just a picture of in the peritoneum when it's full of fluid, right? Ascites can be caused from liver failure, from all sorts of different things, in cancers. The pictures that you see here of these little people here with these bloated abdomens, they are actually starving to death. The bloating is caused from lack of protein in their diet, and you can see how swollen their eyes are and their lips are, and it's from lack of protein. Often happens in countries where mom has several babies, and the first baby comes off the breast, where all the protein from the mom's breast milk, and then they have no protein in their diet, and then so subsequently, as they come off of breast milk, they will develop kwashiorkor, which is what the disease is called, and it's lack of protein. A colostomy, a before and after, it shows you here, of the section that they have taken out. So it is a portion of the colon that is taken out, and they bring the colon to the surface, and then they use a bag or a colostomy device to hold the stool that comes out. Have you got patients with those? Have you had? Yeah. It depends which area it's put. Depends. Most of the time they're done for tumors or ulcerative colitis. It depends what area was affected. I mean, if they had ulcerations here and they took out this section, then it would be higher up. And the problem with that is that the stool coming from here is more liquid. So depending where the colostomy is placed, this would be more liquid stool, which isn't as easily to control. They always have to have the bag on. Now, there's some people who have the colostomy lower down here where the stool is more solid, and they actually can have a bowel movement and then just put a little cover on it. They don't necessarily have to wear a colostomy bag all the time. It depends how well controlled they were. We had one of our nursing instructors in training. She had a colostomy for colitis, and she would just have a normal bowel movement in the morning, and she would take off all of her apparatuses, and she wouldn't worry about it the rest of the day. So it can be controlled. It was quite interesting. She had it really figured out. Peritoneal dialysis, we've talked about that a little bit already this morning, is used to clean the blood when the kidneys no longer are functioning. So they put I don't know if I have a picture of this. I think I do. Yeah, I do. Okay. So they put in fluid into the peritoneum, and it is isotonic, right? It draws out all of the waste products from here. You put it in, and it's about, how liter? It's a good 2 to 3 liter bags that they have. You warm it up to make sure it's not too cold for them. And then you put it in. The patient keeps it in there for a few hours, and then they drain it out several hours later. Depending on the type of solution it is, depends on how much time it's in the abdomen. Depending on the concentration, if it's a highly concentrated fluid, it will draw more toxins out in the faster. As far as being an LPN, we have lots of people on peritoneal dialysis in Penticton, and my students worked a lot with them. And their responsibility wasn't doing the peritoneal dialysis themselves, but it certainly was weighing and measuring and that type of thing of the fluid that's returned. Because you drain all that fluid out and you have to weigh it to make sure, how much fluid you got back out. So aging and digestion. Well, all we can say about aging is everything slows down.
Yeah.
So there's more chance of constipation. There's more chance of heartburn because the stomach isn't emptying as quickly as it used to. There's less vitamins and minerals being absorbed because the small intestine and large intestine aren't as efficient as they used to. So you can get malnutrition. Especially with aging, you'll notice that some people get a lack of proteins in their diet. They don't digest them as well as they used to, and so you'll get some protein-related problems. I don't know if you've experienced people with not enough albumin and they start swelling, like they have swollen legs. It's not from a cardiac problem, it's from not enough albumin in their diet. Dental decay, of course, as soon as your teeth aren't working well, you can't chew your food, so you can't mix the saliva with your food, saliva starts the digestive process. So it starts right in your mouth. So if elderly people have false teeth that don't fit well or teeth that are gone, they're not going to chew their food as well or not mix the saliva as well either. Yeah, I think we chatted about that. And the last one I think was liver disease. If there's any problems with the liver aging, it won't be producing the enzymes that it needs to help with digestion. I think that's the last one. Yay. Okay. So we're going to take a break. Probably that I shouldn't even look at that clock. So do you want to come back at 2:30? That's about 20 minutes or so. So Fahima, we're going to take a break and come back at 2:30 to do the urinary tract, okay?
Okay, sounds good. Thank you.
Thank you. stayed with me for a week. He's from he's from Airdrie now. He was from Canmore. And he stayed and stayed. He says, I got to get back. He says, he's not working right now. He's looking for a job because he's the pilot, right? And so he's not flying in the winter yet. So he's looking. So he didn't have to get back for work, but he said, well, I've got to get back. There's girlfriend and all that other stuff. He was supposed to babysit for my other son. But anyways, he started yesterday, and he said he kept texting me or phoning me on the way because I was really worried about the roads. There were so many accidents. And it took him 14 hours to get from Summerland to, he stopped in Canmore. He gave up. He says, I can't take any more. He said it's white out. There's no lines on the road. There's drifts across the road. He says, you can't even see a road. So yeah, he said it was horrible. Yeah. Yeah, it was terrible. Mm-hmm. Mm-hmm. Yeah, yeah. Right.
It was like, I don't know, like the top of them really hungry, we should eat. And you're like, no, we'll just eat when we get home. I'm like,
is that a good plan? Thank goodness. Yeah. Mm-hmm. Yeah, yeah. Well, I'm so, because I'm diabetic, I'm so conscious of eating, right? I always make sure that the boys and the families, when they're traveling, have something. So I made him a lunch, and I put all this stuff in it. He got stopped for avalanche control for about 3 hours. He sat there, and then they weren't sure whether they'd be able to get through. And I said, I'm so glad I gave him some food. At least he can eat and stay warm. They all laugh at me when I insist that they have food. And I said, no, you guys, you need your food, right? So let's give him a bow. Oh, Alex is here now. Mm-hmm.
I always have snacks in my purse or
yeah.
I always have food in the stomach. I'm so hungry. I'm like, oh, there's some bars here.
Mm-hmm.
She's like, oh.
And people don't realize. I mean, I've been diabetic for 22 years now.
Yeah.
And you don't realize things that happen. You go downtown, I'm driving somewhere and the car stops or there's problems with the car. So you're on the right side of the road for a few hours. If you don't have some food, then I'm in trouble because I need to eat every 2 hours. But they don't realize that these things can happen because I was kayaking up at Pavilion Lake one week, and I was alone. I didn't have a partner, so I'd go everywhere by myself, right? And I was out kayaking, came back in for lunch, and I'd locked my keys in my car. And right away, I had no access to my food. I only had, I take some food with me kayaking, just juice and granola bars. I had that, but I didn't have my lunch. And I'm like, oh my God. So I had to go down to the houses and knock at all these doors. And it was the fall, and most people had left for the summer. I finally found one person at home who was very nice. Yeah, exactly. But it is so important for people to carry food with them. Anyways, we should start on the urinary system. And Alex is here. Hi, Alex.
Hi, Alex.
Came to visit us.
Hey, Jane.
So we're going to start with the urinary system. I just have some some PowerPoints here to show you just the gross anatomy and the cortex on the outside is the whole outside. I just realized I read the other day that the Latin word cortex, it means bark. So it's the bark, right? The bark of it, which is kind of cool. The medulla, which is always the middle, right? And then they show the renal vein, the renal arteries. But these are, it's not written here, but these are the calyces in here, the drain. And you can see these little pyramid shapes that drain the urine after it's been filtrated down into the calyces and then out the ureter down to the bladder. There is a little diagram here also of the bladder. It just shows you the bladder here and your urethra. The urethra is probably, you're going to hear that so many times because you're going to be catheterizing people, right? And that's where you'll be catheterizing them, through the urethra. So you'll hear that a million times in your career. this little diagram here is a nephron, which is the smallest part of the kidney, and that's where all the work is done, where it is all of the diffusion and the taking out of waste products and that type of thing. That's where all that